Bhujang means cobra. While doing this asana, the upper portion of your body is raised above the ground in the same way a cobra raises its hood. To do this asana, you will first have to come in the Makarasana pose, for which you will have to lie down on the floor on your stomach and keep your legs at a distance from one another. Rest your head on your palms and relax your body. Now moving on from the Makarasana, bring your legs close to one another and stretch your arms in front of you. Rest your head on the floor. Now place your palms close to your chest and raise your elbows. While taking a deep breath in, raise your chin up and lift your body up from the floor till your navel area. Take care that your elbow is in line with your body and your legs are stretched in such a way that you do not feel too much pressure on your waist. Breathing in and out normally, stay in this posture for about 15 to 30 seconds. Practicing this asana regularly gives relief from incessant back pain. Bhujang asana reduces stomach fat and provides relief from constipation. This asana also helps in providing relief from breathing-related problems. Patients suffering from hernia or ulcer and pregnant women should refrain from doing this asana. If you have just had a stomach operation, then you should refrain from doing this asana for at least 3 months. Staying in this posture for 15 to 30 seconds, exhale slowly and bring the upper portion of your body down to the floor. Stretch your hands in front of you and come back again in the Makarasana pose and relax your body. Bhujang asana is very useful in relieving tension. Practicing this asana regularly helps in keeping both your body and mind healthy. Shalabh asana. Shalabh is a Sanskrit word which in English means a locust or a grasshopper. To do this asana, you have to first come in the pose of Makarasana. And to do this, you have to lie down on the floor on your stomach and keep your legs at a distance from each other. Keep your head on your palms and relax your body. Now, moving on from the Makarasana pose, bring both your legs together. Now, position both your hands close to your body in such a position that your palms point towards the sky and your chin rests on the floor. Taking a deep breath, lift your legs up from the ground with the help of only your pelvic muscles. Lift your legs up only to the point till you can, without bending your knees. You can take the support of your arms to keep your legs in the air. This will help you keep your body steady. Now stay relaxed in this pose for about 10 to 20 seconds, breathing in and breathing out normally. This asana helps in getting relief from sciatica and pain in the lower back. It also develops the muscles around the pelvis and kidneys. Doing this asana regularly helps reduce the fat on the thighs and also helps in reducing one's weight. This asana is beneficial for our stomach and is also known to help in the digestive process. Pregnant women and people suffering from peptic ulcer, hernia, high BP, and heart disease should avoid doing this asana. If you are suffering from incessant pain in your lower back, then you should take precautions while doing this asana. After remaining in this pose for about 10 to 20 seconds, bring your feet down to the ground while breathing out slowly. After returning to the Makarasana pose, relax your body. This asana helps you to relax both your mind and body. Setubandhasana. Setubandh means formation of a bridge. In this asana, the posture of your body becomes like a bridge. This asana is also called Chatushpadasana. Lie down on your back with a comfortable distance between your legs. Place both your palms on the floor in such a way that they are facing towards the sky. This asana is called Shavasana. Now, join both your legs. Bend your legs and bring them close to your pelvis. Hold your ankles firmly with your hands. Now breathe in slowly and lift your pelvis as much as possible so that your body resembles the shape of a bridge. Ensure that your head and shoulders are on the floor and knees and legs are in one line. In this final pose, you can give support to your waist with your hands if you want. Stay in this pose for 10 to 30 seconds while breathing in and out normally. Setubandhasana strengthens the muscles of your lower back. This asana stretches the internal organs of your stomach to improve the digestive process and giving you relief from constipation. Setubandhasana helps improve cardiac functions. If you are suffering from ulcer or hernia, then you should refrain from doing this asana. Pregnant women should do this asana with utmost care and under expert supervision. After staying in the Setubandhasana pose for 10 to 30 seconds, while releasing your breath slowly, bring your pelvis down to the floor. Release your ankles and come back and relax in the Shavasana pose. Doing Setubandhasana regularly will help you to overcome depression and anxiety.
Uttan Padasana, raised feet posture. In this asana, the legs are raised upward in a supine position, hence the name. Lie comfortably on the ground with the legs stretched out. The hands should be placed by the sides. While inhaling, slowly raise both the legs without bending them at the knees and bring them to a 30-degree angle. Maintain this position with normal breathing. Exhale and slowly bring both the legs down and place them on the ground. It balances the navel center, Nabhi Manipura Chakra. Ardha Halasana, half plow posture. This posture is known as Ardha Halasana because in its final position, the body resembles half the shape of an Indian plow. Take a supine position. Keep the hands by the sides of the thighs, palms resting on the ground. Slowly raise your legs together without bending at the knees. First raise the legs up to 30 degrees, then further up to a 60-degree angle. Now, slowly raise the legs to a 90-degree angle. This is the final position of the Ardha Halasana. The body from the hip to the shoulder should be kept straight. Then slowly bring the legs back to the ground without lifting the head. This is very beneficial for hypertensive patients, but needs to be practiced with care. Those who have lumbosacral or lower back pain should not perform this with both.
Pawan Muktasana. Pawan means wind in English and Mukt means freeing or releasing. This asana helps in removing wind or flatulence from your intestines. Lie down on the floor with both your legs and hands spread at a comfortable distance from your body. Ensure that the palms of your hands are facing upwards. This asana is called Shavasana. Now moving forward from Shavasana, join both your legs, bend your knees and take your thighs close to your chest. Interlock the fingers of both your hands together and hold them below your knees near to your shins. Now, while breathing out, lift your head and shoulders till your chin is touching your knees. While doing this, you will experience stretching in your lumbar region.